Hey, this is Dr. Drew, and today I want to talk to you about one of the most important treatments I use in my practice, and it falls under the regenerative injection umbrella, and it's known as prolotherapy. The reason I'm so high on this stuff is because it literally gave me my life back. It has been the glue that has held me together through all my injuries and chronic pain, and it's ultimately why I got into medicine in the first place. I was around 21, 22. I was pretty banged up from football, chronic injuries, separated shoulder, knee tendonitis, back injuries, and so on. And I stumbled into a naturopathic doctor's office, and in a matter of like 6 months, he helped me reverse all my injuries with prolotherapy. Now, if you've never heard of this therapy before, it is a simple dextrose injection to the injured areas to kickstart a healing cascade. And dextrose or glucose is obviously something the body recognizes and utilizes all the time, so it's a super safe substance. And the benefits will blow your mind and are quite miraculous. So if you have any ligament, tendon, or joint problem, you may be a candidate for prolotherapy. And it works incredibly well because it just harnesses the healing capacity and the potential of the bodies to restore collagen to its original tensile strength in the case of a tendonitis or a muscle tear. And maybe you have a ligament sprain or you twisted your ankle or knee and that instability just won't go away. This is where prolotherapy can absolutely turn things around and can be a total game changer for you. With a simple injection of a bit of a sugar water solution with a tiny bit of local anesthetic, in as little as 3 to 6 treatments, you can have that joint back. So say your knee's been the bad knee for months or years, and you've tried chirophysio massage, failed physical therapy, and it's just forever kind of giving you problems and you don't know what to do. That's where you need to kind of reach out and look for, who's doing regenerative injections in my area? What can I maybe look into as an alternative that I haven't tried yet? And just when you think you've tried everything, the answer is you probably haven't. And that was my kind of case. I was on painkillers, I did chirophysio massage, separated shoulder wasn't getting better. I couldn't even bench press the bar without searing pain, feeling like it was a knife going into my shoulder. And then I stumbled in, got some Prolo, and it's like, that's my stronger shoulder now. It's crazy. Now you might think, well, isn't this just like a cortisone shot? And the answer is no. It is the exact opposite of a cortisone shot. If you look at prolotherapy head to head versus a cortisone shot, there's really no comparison. I'm going to go through a little chart with you right now and we'll flash it up on the screen. So with respect to strengthening bones and the exact site where the tendon threads into the bones, prolotherapy strengthens that junction, cortisone weakens it. So that helps with the muscle, tendon, and the bone tendon junction, right at the site of pain and dysfunction. Inject that area, it kickstarts a healing cascade. You get blood flow, healing, circulation, and all the collagen deposition molecules, they come to that area and they knit that tissue back together. Cortisone does the exact opposite. With respect to muscle strength, you're going to see an increase, and then the muscle will fire better and have less trigger points once you get the anchor point or the tendon issue sorted out with prolotherapy. Cortisone, exact opposite, is going to weaken the muscle. And then if you look at ligamentous tissue, so say you sprain a ligament, you're trying to tighten it back up and get it back to that pre-injury status, prolotherapy will help with that. Cortisone will not. It will shut that down. And then if you look at immune system activity in the area, immune system activity goes up with prolotherapy injections locally because you've actually stirred the area up a little bit, selectively and specifically because of the dextrose being that irritating agent. But cortisone will suppress the immune system locally. It'll decrease blood flow. It will help with pain and inflammation, but again, it's just a band-aid because your body puts out the pain and inflammation because something's wrong. So you want to be able to harness that and focus it with prolotherapy as opposed to just suppressing it and shoving it down with a cortisone shot. You may only get a few weeks to a few months relief with that, and then you're back to square one, haven't actually dealt with the tear or the sprain or the meniscus issue or the cartilage problems. And that's where these regenerative injections can be game changers, okay? And so when you compare Prolo to cortisone, there's really no comparison. And the trouble with cortisone is you can only usually do each area or joint 2 to 3 times max lifetime before the area is at high risk of bad complications and side effects down the road. And this is why in certain cases, like say you have a turf toe or an issue in the foot, sometimes people are even hesitant to shoot cortisone in that area because it suppresses the healing and the blood flow and the immune system activity in that area. And then if there's an infection, sometimes you're at risk of losing the toe or the foot. You'd never see that with a prolotherapy injection because it's a super benign, gentle, easy for the body to deal with sugar water solution. So pretty powerful stuff. Now I mentioned at the start, it is under the umbrella of regenerative injection treatments. So there's a few others that you can think about as well. So you got prolotherapy, foundational at the bottom. I would say about 75 to 80% of people I treat with Prolo get really good results in 3 to 6 treatments. However, there are those stubborn cases, advanced arthritis, maybe they're a professional athlete or someone performing at a high level that they need to move quicker. That's where the next one is going to be PRP, platelet-rich plasma therapy. You will draw the blood out of someone, you'll spin it down into those golden cells known as platelet-rich rich plasma, and you can shoot that into the injured area, whether it's the ligament, the tendon, the joint, maybe if there's knee arthritis, etc. And then we have stem cells at the top. So it's prolotherapy, dextrose, PRP, your own blood concentrated down to the platelets, and then stem cells, which is usually derived from fat or bone marrow. These procedures are very hard to find in Canada. They're widely available in the States or abroad. And so I always tell people, start with the foundational stuff, graduate up as needed. Obviously the cost and the procedure goes up and changes, but those can be game changers. It can keep people from surgery. It can give them their life and their joints back. And I say life first because when you're dealing with chronic pain, your mood isn't good. Maybe you can't work. Maybe you're off on like an injury claim. You don't know really where this is going. And it can be extremely depressing for people, and it can put them in a really bad state in their life. So you don't just give them their joint back, you give them their life back. And so if no one has ever mentioned this to you, or you just had pain pills thrown at you, anti-inflammatories, opioids, that's how a lot of that crisis happened. Is just like there's not a lot of good treatments for chronic pain. And the best ones that work, I'm telling you about right now, it's like most people don't even know exist. And obviously, whether insurance covers it or not is a whole nother ball of wax. But I always tell people this: if you let insurance companies dictate your treatments, you will be in trouble. So you got to find the ones that work for you and explore some of these lesser known ones, because people have entire practices built around these regenerative injections, and they work so amazing. If it's a healthy person, an athlete, someone that's looking after themselves, it's like 3 treatments done. Maybe a little bit more stubborn, chronic, long-standing cases might need a little more, but it can completely change your life like it changed mine. And that's why I decided to go back and study medicine and bring this to the masses, because I was like, why don't more people know about this? I was almost pissed off when I found. I was pissed off and relieved, but I was a little bit upset because I was like, why did I see like 5 people and no one mentioned this to me till now? Like, that's a little weird. Something that could be really helpful in fixing this problem nobody mentioned. Obviously, factors that improve healing or decrease healing need to be considered with these cases. So, if people are on a lot of medications, diabetes, metabolic issues, poor blood flow, they're obviously not going to respond as well. If you're taking NSAIDs, anti-inflammatories all the time, well, of course you're not going to respond as well with that either, because it suppresses blood flow and healing, and kind of gets directly in the way of what we're doing with these injections. But yeah, just some things to think about there. If you're well hydrated, good body weight, blood sugar is balanced, you're getting enough protein and collagen, it's like vitamin C, this works wonderfully well, okay? And then you just kind of let the body do its thing. You sit back and let the healing and rehab begin. So if that sounds like you, or you have pain, inflammation, joint problems you can't sort out, and you have further questions on this, just drop a comment below. If you think someone in your world would benefit from seeing this video, please share it with them. And as always, thank you for watching.